Merci beaucoup, Jean-Sébastien. Good afternoon, everyone. Thank you, Jean-Sébastien. Today, I'm joined by my colleague, Minister Carla Qualtrough, who has an important announcement to make. And we're also joined by Doctors Tam and Njoo. So, on va commencer avec la ministre Qualtrough et ensuite on ira au Dr. Tam et au Dr. Njoo. We'll begin with Minister Qualtrough, and then we'll go to Dr. Tam and then Dr. Njoo. So, Carla, over to you.
Well, thank you. Hello, bonjour tout le monde. Je suis heureuse de me joindre à vous aujourd'hui à partir du territoire traditionnel des Premières Nations, Tsawwassen et Musqueam. On ne peut pas contester que l'année dernière a été très dure pour tous les Canadiens. Et pendant cette année très difficile, notre gouvernement a été là pour soutenir les Canadiens et leurs familles. While the COVID-19 pandemic has affected everyone, we know that the lives of persons with disabilities have been disproportionately impacted, especially when it comes to health, social well-being, and financial security. The pandemic also challenged and stretched Canada's support systems. Significant systemic gaps were revealed or further exacerbated, shedding light on long-standing inequities and discrimination. Since 2015, our government has worked tirelessly to lay a strong foundation that ensures the inclusion of persons with disabilities. From signing on to the optional protocol of the United Nations Convention on the Rights of Persons with Disabilities and passing the historic Accessible Canada Act, to our disability equality statement and honoring the principle of nothing without us, we have remained committed to a disability inclusive and human rights approach in our decision-making. As we take stock of the repercussions of the COVID-19 pandemic on our country and enter our recovery phase, we are staying true to our long-standing commitment to build back better and leaving no one behind. There are 6 million Canadians living with a disability. In 2017, nearly 850,000 working-age Canadians with disabilities lived in poverty. This includes women, men, LGBTQ2, racialized Canadians, and Indigenous people, all with disabilities. And we know that the pandemic has made things worse and hit persons with disabilities much harder. I've no doubt that the number of Canadians with disabilities living in poverty has only increased during the past year. This is unacceptable. Au moment où notre économie commence à s'ouvrir et les restrictions de santé publique sont levées à travers le pays, nous avons l'occasion de renouveler notre engagement en faveur d'un Canada accessible et inclusif. Il nous incombe de veiller à ce que notre relance économique soit inclusive. C'est pourquoi nous franchissons aujourd'hui une étape historique en vue de donner un soutien financier durable à long terme aux personnes en situation de handicap. I'm very proud to say that earlier today I introduced legislation to create the Canada Disability Benefit. This first of its kind Canada Disability Benefit would be modeled after the Guaranteed Income Supplement for seniors, which means it's intended to complement other sources of income for persons with disabilities, such as the Canada Pension Plan or provincial and territorial social assistance. This benefit is the cornerstone of the government's Disability Inclusion Action Plan, a plan designed to help improve the financial security of persons with disabilities in Canada, among other objectives. It will be ambitious, evolve over time, and will have a focus on action. Together, the Canada Disability Benefit and the Disability Inclusion Action Plan have the potential to lift hundreds of thousands of people out of poverty, help persons with disabilities find quality work, create more inclusive spaces, and address long-standing inequities. Our hope is to trigger a generational change to income support that will become part of our broader social system in the same way that the CCB, Old Age Security, and the Guaranteed Income Supplement are doing. The legislation introduced today provides a framework for the benefit. It does not establish specific design elements. This is intentional. In the spirit of nothing without us, we will work with the disability community through the summer and beyond to ensure this benefit is designed with their input in mind. We will also engage with our provincial and territorial government partners who already play a central role in providing support to many Canadians with disabilities. I look forward to meeting with my provincial and territorial counterparts on July 21st for an initial discussion on the new benefit and to hear their views. I'm very proud that this new Canada Disability Benefit legislation is the latest action our government has taken. By working together, we can change the lives of hundreds of thousands of Canadians with disabilities living in poverty. Thank you. Merci beaucoup.
Merci beaucoup, Carla. Alors, on va maintenant écouter la Dr Tam et ensuite le Dr Njoo. Alors à vous, Dr Tam.
Thank you, and bonjour à toutes et à tous. Nationally, 7-day rolling averages continue to decline. Our current national case count is down to 900 new cases reported daily. On average, 1,244 people with COVID-19 are being treated in our hospitals each day, including 573 in intensive care units, and an average of 21 deaths are being reported daily. The progress we've made in just 10 weeks since the peak of the third wave is gratifying to see. Not only have we persevered through many difficult weeks, we have shown great strength as a country. By keeping up with precautions and weathering restrictions, we have reduced national case counts by over 90% and significantly reduced hospitalization numbers, which is helping the health system as it begins to recover. At the same time, public health authorities across the country have more than tripled the number of vaccine doses given from 10 million up to mid-April to over 32 million to date. This is thanks to a rapid increase in vaccine uptake as Canadians have come forward in record numbers, adapting to new information, navigating through new systems, and creating information sharing networks and supports. These efforts have helped elevate Canada to the top 10% of countries with the highest per capita number of vaccine doses given worldwide. Although COVID-19 is still presenting us with challenges, including emerging variants that spread faster and cause more severe illness, we've shown that we have what it takes to control this disease. Our sacrifices through the winter and spring bent the curve as vaccines were rolled out. Now, based on the latest unofficial numbers, we have already surpassed our initial targets of over 75% of the population 12 years or older with at least one dose, and over 20% fully vaccinated. But this is not the time or place to stop. Meeting these initial targets has brought us greater safety, allowing jurisdictions to start the cautious easing of restrictions that will give us the better summer we've worked so hard for. However, the job is not done. With COVID-19 still circulating in Canada and worldwide, we need to remain vigilant while keeping up the momentum to build a higher wall of vaccination protection for the fall. So whether you are ready for your first dose, nearing your second dose, or fully vaccinated and able to help others who may need information, assistance, or other support, let's keep working together and get Canadians protected and vaxxed to the max. Thank you. Merci. Megwich.
Bonjour à toutes et à tous. À l'échelle nationale, les moyennes sur 7 jours continuent de baisser. Le nombre moyen de cas déclarés au pays est maintenant de 900 nouveaux cas par jour. Le nombre moyen de personnes atteintes de la COVID-19 traitées dans nos hôpitaux chaque jour est de 1244. Et de ce nombre, 573 étaient traités dans des unités de soins intensifs et en moyenne, 21 décès ont été déclarés par jour. Il est gratifiant de constater des progrès réalisés en aussi peu que 10 semaines depuis le pic de la troisième vague. Avons-nous persévéré au cours de nombreuses semaines difficiles, mais nous avons également démontré la grande force de notre pays. En continuant d'observer les précautions et en s'accommodant aux restrictions, nous sommes parvenus à diminuer le nombre de cas au pays de plus de 90% et à abaisser sensiblement le taux d'hospitalisation, aidant aussi ainsi le système de santé au moment où il commence à se rétablir de la crise. Parallèlement, les autorités de santé publique partout au pays ont plus que triplé le nombre de doses de vaccins administrées, passant de 10 millions à la mi-avril à plus de 32 millions à ce jour. Cela est dû à une augmentation rapide de taux de vaccination en raison d'un nombre record de Canadiens qui se sont présentés dans les cliniques de vaccination, se sont adaptés aux nouveaux renseignements communiqués, ont su s'adapter à de nouveaux systèmes et ont mis en place des réseaux de partage d'informations et autres outils connexes. Grâce à ces efforts, le Canada fait partie des principaux pays ayant le nombre le plus élevé de doses de vaccins administrées par habitant dans le monde. Mais même si la COVID-19 présente encore son lot de défis, notamment des variants qui se répandent plus rapidement et intensifier les symptômes de la maladie, nous avons démontré que nous sommes en mesure de contrôler cette maladie. Les sacrifices consentis à l'hiver et au printemps dernier, pendant que la campagne de vaccination se mettait en branle, ont permis de faire pencher la courbe. Aujourd'hui, selon les dernières statistiques non officielles, nous avons dépassé nos objectifs initiaux. Plus de 75 des Canadiens âgés de 12 ans et plus ont reçu une première dose de vaccin et 20 ont reçu les 2 doses. Mais il ne faut pas s'arrêter là. Atteindre ces objectifs initiaux a permis d'améliorer la sécurité de la population et les administrations peuvent maintenant commencer à alléger prudemment les restrictions et ainsi nous permettre de bénéficier d'une plus belle été pour laquelle nous avons travaillé si fort. Cependant, la lutte n'est pas terminée. La COVID-19 se propage toujours au pays et dans le monde entier. Nous devons demeurer vigilants et continuer de se faire vacciner afin de nous assurer une protection maximale en vue de cet automne. Alors que vous soyez prêts à recevoir votre première dose, que vous vous apprêtiez à recevoir la deuxième ou que vous ayez reçu les 2 doses de vaccin et soyez en mesure d'aider les Canadiens qui pourraient avoir besoin d'informations, d'aide ou d'un quelconque autre soutien, continuons à travailler ensemble pour protéger les Canadiens et faire en sorte que le plus grand nombre possible d'entre eux soient vaccinés. Merci. Thank you. Miigwech.
Merci beaucoup, Dr. Njoo. Alors, nous sommes prêts maintenant à prendre les questions. Thanks, Dr. Njoo. We're obviously happy to take any questions. Jean-Sébastien, à toi.
Merci beaucoup, Monsieur le ministre. Donc, nous allons maintenant débuter la période de questions. Ministers and doctors will now be happy to take your questions. As usual, it will be one question and one follow-up per reporter. Comme d'habitude, ça va être une question et un suivi par journaliste. And I will now pass it over to the operator for the first question. Je vais maintenant passer la parole à l'opératrice pour la première question.
Merci. Thank you. The first question is from Mia Robson from the Canadian Press. Please go ahead.
Yeah, I think this question is probably for Dr. Tam. I'm looking at the vaccine numbers, and we now have more than 7.5 million Canadians who are fully vaccinated. You mentioned that it's sort of past that first goal of 21% or 20%. I'm just curious why we still have not provided any guidance to Canadians on what they can safely do once they're fully vaccinated. We already see people sort of making those decisions for themselves without a lot of guidance. So why is Canada not prepared to provide some advice to Canadians on what is safe and not safe for them to do as they become fully vaccinated?
Yeah, I think this is a really good question, especially at this point in time that most Canadians will have access to their second dose. And so we are, in fact, having these very discussions with our colleagues, the other chief medical officers, as we speak. And so we expect to undergo these discussions rapidly and provide further communication to Canadians.
Okay, but I guess what I'm still sort of curious why we haven't done that so far. I mean, we knew this was coming. It's not a surprise to Canada that the vaccination rate was picking up. We've known that for weeks. How come we still are not ready to provide people with this advice, even as we know people are taking that matter into their own hands?
Yeah, I mean, the first point of recommendation is still you must follow your local public health advice. That is really important because it's not the same in every part of the country. Individuals with underlying risk factors have a very different set of risk assessments as well. So it would depend. These risk assessments depend on your individual risk, who you're about to get into a contact with, as well as the epidemiology of your specific community. So these are some of the consideration, and what we would like to do is take Canadians through some of these risk assessments that they can do for themselves now that we're at this stage. One primary driver is that we have been focused in getting people vaccinated so that everybody has access to vaccine at this point is a great turning point. It's very difficult in the community to tell who is vaccinated and who's not. It's actually really difficult also to, even if you're vaccinated, you don't know what situation you're getting into or the vaccination status of others. But I think soon people will know that disease activities are low and the majority of the people around them are probably vaccinated. And that gives you a, really the key piece of risk assessment to work with. But just as we are shifting our border stance for vaccinated individual, this is a good time to do this additional advice for people in the domestic context. But my colleagues from the provinces and territories, still their primary message is, please, even if the federal government puts out any kind of advice, the first thing is to say this is in the jurisdiction of the local and provincial governments, and that they will be providing more details as to what people can do in their own context.
Yeah, it's Dr. Njoo. Maybe I can just add a few comments to what Dr. Tam has said. Certainly, the key thing for us is obviously is that people should look at their local epidemiology and listen to local public health authorities, because obviously it's a big country and there's obviously different situations throughout the country. So listen to local public health authorities. Now that many more Canadians have got their double vaccination, as Dr. Tam said, I think in the coming days and weeks you will see the federal government coming out with different types of risk assessment tools, because I think that Dr. Tam's point, there's no single size fits all. You can't tell everybody, yes, you can all do this. It really depends on your individual context. So, based on your own health status, what the vaccination status is of maybe the people you want to maybe socialize with, all these other factors come into account. And so I think it's important to tell Canadians and show Canadians that there are tools available in which they can take all those different factors into account in making their own personal risk assessment and what they might then feel comfortable doing. So I would say watch this space, and things will be coming out in the next little while. Thank you.
Jean-Sébastien, êtes-vous là? Operator, are you able to hear us?
Roxane, à la téléconférence, est-ce que vous êtes toujours
I can hear you.
connecté?
I thought I was the one frozen, maybe, or...
We can hear everything going on with the ministers, but it seems they cannot hear us.
Non, moi je peux vous entendre tout de suite.
Okay, we'll take the next question. On va prendre la prochaine question, Roxane, s'il vous plaît.
Parfait, merci. La prochaine question, Marie Vastel du Devoir.
Oui, bonjour. Je vais juste vérifier parce qu'il semble y avoir des pépins. Que vous m'entendez bien?
Oui, bonjour Marie, c'est Dominique, je vous entends bien.
Merci. Je pense que ma question est pour Dr. Tam. I think so. I'll ask it in English. I wanted to get back on what was announced yesterday for the border and Canadians coming back from abroad and quarantine exemptions. There seem to be different opinions on people who have gotten COVID-19 and whether they require 1 or 2 doses of a vaccine. And the government has been saying that their own scientific experts are looking into it. But I wonder, what have you been told so far by those scientific experts? Should we understand with the announcement yesterday that only people who have gotten 2 doses of the vaccines that are approved here, that only people fully vaccinated will be able to have this quarantine exemption when they return to Canada? Should we understand from that your own scientists are not convinced that 1 dose is enough for people who have had COVID?
Thank you for that question. So you're correct that at this time, travelers must have received the full series or the combination of vaccines accepted by the government of Canada, and at least 4 days prior. So that is the policy at this time. The National Advisory Committee on Immunization, of course, reviews information on an ongoing basis. And at this time, their recommendation is that those who've had a previous COVID-19 infection continues to get the full series of vaccine. So while I think we totally appreciate Quebec's analysis and their perspective, all the other provinces and territories are following the NACI recommendation at this time. And so as the federal government, we can't have all sorts of very different policies for people from different parts of the country, and indeed for other parts of the world, because it's not just Canadians coming in, is whoever is permitted to come into Canada at this time. So we can't make all sorts of different policies. So, but we will absolutely continue to have further discussions with the province of Quebec, and also awaiting any further updates that the National Advisory Committee on Immunization will have. I know that they are reviewing information. There may not be a huge amount of data at this point on this question.
Thanks. You say, though, that at this time the committee continues to recommend 2 doses. So what I'm trying to hear from you is what their evidence points to at this point. So I gather that their evidence points to 1 dose not giving you sufficient immunization. Can you elaborate on that? And you say that your experts are still looking into the issue. When do you expect an update, I guess, on this question?
Well, I think data comes in on an ongoing basis. I've last seen one publication which suggests that you will mount a pretty good antibody response. This is not a vaccine effectiveness study, but an antibody response after 1 dose post COVID-19. But that's like, one study that I've seen anyways. But there will be others that the committee will be reviewing. So that's the state of the evidence to date. And I also know that Quebec has many great vaccine experts, and they have been monitoring vaccine effectiveness. So they may actually provide some of the first information too about the effectiveness of 1 dose after having had COVID-19. We just don't know enough, and probably not for each of the different vaccines either. But the National Advisory Committee have made recommendation based on the global review of evidence. So I expect that they will take that into account. But at this point in time, we don't have enough information to change that policy at the moment. So that's one aspect. The other aspect, of course, for anyone traveling to outward bound people to another country, please do check what the requirements are from other countries. I haven't seen that many. There are some that have accepted 1 dose post COVID-19 infection, but that is a varied landscape. The other is that at this point in time, we are focusing, of course, on the proof of vaccination. And in the Quebec situation, we would also have to have a discussion on how do you prove that that person had COVID before. So it adds another layer of complication to how do we make this work. So it's not just the science, but also then if the science is indeed verified in that context, is how would we know someone's had previous COVID and therefore 1 dose is enough. So it's not all as simple as maybe people kind of initially think.
Yeah, it's Dr. Njoo. Maybe I just said just 1 or 2 additional comments to what Dr. Tam has said. So yes, the first point, definitely, it's not only about Canadians and other travelers coming to Canada, we also need to look at, Quebecers need to look at what the requirements are for traveling outside of Canada, what would be accepted by other countries. But with respect to the scientific aspects of getting one dose after natural infection, I guess people know, and we've seen from the experience in other countries, that you can't get, quote, reinfected. So if someone's had a previous COVID-19 infection, maybe with the original wild strain, you'll have immunity for a certain period of time, but it's still not clear yet how long that immunity lasts. And certainly the fact that you are still susceptible to some of the newer variants that are obviously emerging, that's something that's important to consider. So at this point, based on what we've seen from the vaccine effectiveness studies, certainly 2 doses give you good protection, and certainly it seems to be long-lasting for both the original wild strain, but also variants which are emerging. So that's all being taken into account as we continue to monitor the evolving science. Thank you.
Thank you, Dr. Tam and Dr. Njoo. Opératrice, prochaine question. Operator, next question.
Thank you. The next question is from Mackenzie Gray from CTV News. Please go ahead.
Hi, my first question is for Minister LeBlanc. Going back to yesterday's announcement, Minister, officials said in the technical briefing to journalists that using the ArriveCAN app is going to be mandatory, and if people did not use the ArriveCAN app to show proof of vaccination, if they came with a paper documentation of their vaccination, they would be fined. To come to the border and get in, you have to have a passport, which is made of paper. So I'm wondering why the government is making it mandatory to use the app, and can you tell us how much the fine is going to be if you don't use the app?
So thank you for the question. Obviously, the use of the ArriveCAN app as an interim measure or as a transitional measure until we get to a more long-term proof of vaccine certification is the best way for incoming travelers to be able to prepare an efficient arrival, fully vaccinated travelers who come to Canada after July 5th. So our hope is that people will use, as has been the case for essential workers or others who've been traveling during the context of the pandemic, use the ArriveCAN app. Obviously, there are around any of these processes issues of equity that we're going to work through. The government is not insensitive to those concerns. We understand that this can be a challenge, and we'll find the appropriate way forward. Our colleagues at the Border Services Agency are very much seized with this, and we'll find the best solution for Canadians.
My second question is for Dr. Tam. Obviously, going again about the announcement yesterday, there's a lot of upset Americans who have been fully vaccinated for many more months than most Canadians have been. We're sitting in Detroit or in upstate New York, wanting to come to their cottages or come visit family members in Canada. What is the medical reason that a fully vaccinated American can not come into the country when a fully vaccinated Canadian can come into the country?
So I think, I do think that the vaccines provide really critical protection. And right now, though, we still require some testing of travelers on arrival, even if you're vaccinated, because of the potential for variants of concern. And that, as we begin to roll out the program, it's really important for us to continue to do that surveillance. But I think one of the critical aspects of where we're at is that Canada at the moment is coming down, sure, to the bottom of its third wave. Some provinces are still, at getting there. Manitoba, for example. Others are dealing with new outbreaks. And I do think that kind of decision can be made when there's more resistance, if you like, or resilience in the Canadian population to introductions and importations. And any layer of border measures is an imperfect layer, as we've always said. The vaccine does add a very important layer, but it is much safer, I think, for Canadians if the borders are reopened at a time when most Canadians have had 2 doses given the variants of concern. So I think it's not a simple answer. We take into account the domestic vaccination rates, the domestic epidemiology, and whether we can still cope with any resurgences. We look at still that the vaccine remains effective against variants of concern, and that we're looking at international epidemiologic context. In the case of the United States, I do think that the epidemiological context has been trending in the right direction as well. And so all of those parameters will be taken into account. And I believe the Prime Minister has just said that he'll be looking at that in the next weeks.
Thank you very much, Dr. Tam. Operator, next question. Beatrice, prochaine question.
Thank you. The next question is from Marika Walsh from the Globe and Mail. Please go ahead.
Good afternoon. Dr. Tam, I'm wondering, just to go back to Mia's questions, can you please be more clear on what guidelines Canadians should expect, and how do you explain or justify to them that this information is not yet available?
Mm-hmm. So I'm sure you've heard that vaccinated people can get infected. So even the most effective vaccines are not absolutely perfect, and that it is really important for people to protect each other as well. Many people who have had full doses of vaccine, some of our most higher risk people are seniors and other high risk populations that may be the ones who, even after vaccination, it would be important for them to also be protected by the protection that the community around them affords. And so that is really important. But here's the kind of information that I would expect we'll be providing is taking people through the individual risk assessment. So have I had 1 dose, 2 dose, or no dose? What is my underlying medical factors and risk conditions? Who is it that I'm about to encounter or meet? And are they do I know anything about them? Are they vaccinated? Am I in an outdoor or indoor setting? So I think that kind of a tool will enable each individual to assess that in their own individual context, and not the least of which, things like epidemiologic conditions in their communities. If there's a Delta variant, which is actually really active in your community, and there are a few communities in Canada right now, even if you are vaccinated, but you happen to have an underlying medical condition, you may make a slightly different choice than if you were in another setting. So because it's not a straight black and white sort of everybody take off their masks, everybody just do whatever you want, we would like to enable people to take themselves through that kind of risk assessment while respecting local public health requirements.
Okay, thank you for that. My next question is for Minister LeBlanc. I think journalists have been trying to maybe tease out some threads on the government's next steps on the travel. We heard the Prime Minister say today that it will be weeks, not months. Does that mean more changes are coming in weeks, not months, or more information is coming in weeks, not months? And yesterday, Minister Blair told CBC that the next phase would be allowing in fully vaccinated foreign nationals, but only when Canadians are 75% fully vaccinated. Can you just please confirm if that's the case and shed some more light on the next step?
Sure, I'll offer some comments, and Dr. Tam or Dr. Njoo can probably also add some detail. I think it's correct to say, and Marika, it could be both. We could have in the next number of weeks both more information and more changes with respect to our posture at the border. We've said that the measures that we put in place have been very effective. They're amongst, as you've heard many times, amongst the most stringent in the world. But we also recognize that they're not to be permanent, and Canadians are understandably impatient to be able to return to more of a pre-pandemic context in terms of their travel plans, in terms of visiting family members or having friends or family members come to Canada. We understand and share that sort of anticipation for a moment when it's prudent and safe to do so. I think the Prime Minister outlined again today what we talked about on Monday is a series of phased approaches to diminishing or relaxing these measures, always guided obviously by the advice of public health experts, scientists, and doctors. I noticed even in the comments with respect to our announcement on Monday, there is, again, a difference of opinion amongst some scientific experts on the pace at which these changes should come into effect. So we're going to continue to work with scientists and Dr. Tam and her colleagues, be informed obviously by their advice. We're talking on an ongoing basis to provincial and territorial governments, but we're also understanding the very real concerns of sectors of the economy, of business leaders, tourism, the travel sector. Obviously, they're anxious for the moment when it's safe to proceed to the next phase of those measures. On the 21st of each month, so July 21st, we would have to renew the orders in council, which are the legal documents that give effect to the measures at the border. So obviously, as we approach that date in 3 or 4 weeks, we'll be looking to see what is the prudent approach to have in place after that. So I think Canadians should know that, as has been the case from the beginning, the most important priority from the Government of Canada's perspective has been to protect the health and safety of Canadians, and that has to remain, in the context of COVID, our most important responsibility. But we're encouraged. We're encouraged by the trends in terms of vaccination, in terms of case counts, in terms of hospitalizations. So we look forward, as all Canadians do, to having more to say about that in the coming weeks. But Dr. Tam may want to add, with respect to your specific questions, some additional information. In fact, it may be the first time she's been able to discuss publicly since the announcement yesterday. So Dr. Tam, over to you.
Yeah, I do think, thank you for allowing me the opportunity. I do think that the initial stage is quite precautionary, especially given the majority of Canadians have only had one dose. So as I've just said, knowing that the majority of Canadians have had 2 doses in the light of the spread of the Delta variant is a very important consideration. And so we are tracking that for sure. That is one of the key indicators. Secondly is, as I said, vaccines remain effective. Now that data, as you've seen, comes through to us in real time from other countries and domestically. When a variant appears, it takes a little bit of time to assess, well, here's a new variant, the Delta variant. We got confirmation from the United Kingdom that in fact the vaccines do work, but you need 2 doses. So that's another variable that we've been tracking, and we can, at this point in time, today, say that our vaccines do work against the variants that we have circulating in Canada. Do I know what might happen next week or the week after that? Not necessarily, but right now that's looking good too. The domestic disease activity remaining manageable. You probably can see what those indicators look like. The R value, that reproduction number, the hospitalizations rate and deaths, those are the lagging indicators. ICUs, recalling that Manitoba is still having heavily impacted by the ICU capacities. But even that, I believe, is being stabilized. So we will look, of course, some of the indications are done through our modeling studies. And I think those are also trending in the right direction. Then we're looking at the fully vaccinated versus the unvaccinated travelers, and some of that work has begun with phase 1. And then the international epidemiologic context. Right now, for example, in the United States, as I said, that's one country where we have, I think, good information, and that they are also trending in the right direction. So the international epidemiological context is important, and that we also have the capacity to surge and be able to react. And as some people call it, circuit breakers, should the need arises, and that there is a rapid increase in cases or variants of concern. So, and that we have that capacity to sequence, trace, etc. All of those, I believe, are also trending in the right direction. So, when I initially communicated the 75-20 vaccine coverage and the 75-75, it was in the context, of course, of the domestic reopening and easing of public health or the more restrictive measures. But I do think that that kind of benchmark is can be also taken into account when we're looking at the international border. Many provinces would expect us to, of course, be quite cautious, and that they need to begin. I need to see them what happens when they beginning to ease their measures as well. And so that's why we're treading cautiously at this time. But all those indicators that I've just listed, if they're all trending in the good direction, as the Prime Minister said, in a few weeks, he'll have more to say.
Thank you, Dr. Tam. Operator, over to you for the last question. Donc, opératrice, à vous pour la dernière question.
Thank you. Merci. Our last question is from Rafi Boudjikanian from CBC News. Please go ahead.
Thank you. The question is for Dr. Tam. I was just wondering about the discussions about Quebec that happened earlier in the news conference. You also mentioned that we can't have different policies for different parts of the country. And so I guess I'm wondering, have you behind the scenes had any conversations with Quebec Public Health about moving away from this urge to not vaccinate people who've tested positive for a second time? And if you have not, why not?
Well, we're in regular discussions with Dr. Arruda, for example, and our counterparts in Quebec. They do know where we stand at the moment, and again, they are, of course, open to and have been open to bilateral discussions. But no, we have ongoing discussions, and not just with Quebec, obviously. It takes into account his colleagues too in the other provinces and territories. And yeah, they are ongoing.
Okay, and just going back to Mia Robson's question about issuing federal guidelines, I understand you're saying, follow local public health guidelines, and that's important. When we look south of the border, the Centers for Disease Control issued federal guidelines there as early as March, and, the United States is much bigger and has many more jurisdictions than we do. So I'm having a hard time understanding why this isn't done yet in Canada when it seems to have been so easy to do just with their neighbors.
Yeah, so as I said, stay tuned. This is being discussed as we speak.
Thank you, Dr. Tam. Donc, voilà qui met fin à cette conférence de presse. That marks the end of the press conference. Merci d'avoir été parmi nous. Thank you for joining us today.
Merci. Bon après-midi. Happy afternoon, everybody.